Hey everyone, welcome to Daily Dose of Medicine. In this video, I'll be talking about opioids. First of all, what are opioids? Opioids, sometimes called narcotics, are medications prescribed by doctors to treat persistent or severe pain. For example, we can give for chronic headaches, backaches, and by patients recovering from surgery or experiencing severe pain associated with cancer. These are the examples. Generally, we are using for severe and persistent pain. Opioids can be prescription medications often referred to as painkillers, or they can be so-called street drugs, such as heroin. In addition to controlling pain, they can make people feel relaxed, happy, or high. Thus, it can be addictive. It can create dependence. How do they work? Opioids attach to proteins called opioid receptors on nerve cells in the brain, spinal cord, gut, and other parts of your body. When this happens, the opioids blocks the pain messages sent from the body through the spinal cord to the brain. And the most commonly used opioids are prescription opioids such as OxyContin and Vicodin, fentanyl, a synthetic opioid, 50 to 100 times more potent than morphine. It's a special drug. We will talk about it. Heroin, illegal drug. And other opioids are codeine, hydrocodone, oxycodone, oxymorphone, morphine. Let's talk about fentanyl. It's a special one. Fentanyl is synthetic opioid pain reliever. It is many times more powerful than other opioids, and it's approved for treating severe pain, typically advanced cancer pain. And we have side effects such as constipation, drowsiness, nausea, thought and memory problems, vomiting, and they are also linked to increased falls risk. A 2018 retrospective observational multicenter cohort study, they were found that recent opioid use is associated with a greater risk of falls in older adults and a greater likelihood of death in those with fall-related injuries. That was another side effect. Let's talk about dependence. It's common to develop dependence on certain medications if you use them for a long time. If you physically depend on a medication, you will have withdrawal symptoms if you stop using it. And we have symptoms for withdrawal: restlessness, muscle and bone pain, insomnia, diarrhea, vomiting, chills with goosebumps, involuntary leg movements. And we can have overdose. An overdose, pinpoint pupils, as you can see from image, is really important sign. Falling asleep or loss of consciousness, slow, shallow breathing, choking or gurgling sounds, limp body, pale, blue, or cold skin. So it's important to know these signs. You should know these signs because when you remember these signs, you can treat this overdose with naloxone. Naloxone saves lives. It really does. An opioid overdose can be reversed with drug naloxone when given right away. Naloxone and opioid receptor antagonists given intravenously, which displaces opioids from their receptors and quickly reverses the effects of an opioid overdose. And naloxone competes with opioids for the kappa and delta opioid receptors, but it has the highest affinity for mu receptors. So naloxone really saves lives. So that was the end of the video. If you liked it, please push that like button, subscribe, and share this video with your friends. And take care.